Hi, everybody, and welcome to The Healthy Healer. I'm Dr. Fred, and I'm the host of this program, and it's just an honor and pleasure to be here with you this morning. On a weekly basis, I like to bring you doctors and other healthcare workers who have gone through a lot, who've already had a life in the field, and who have much to say about how they got to be who they got to be, as well as who they are for others who are having some difficulty or maybe even already aligned with who they are in the healthcare field. It takes something to be a healthcare worker. It's a lot different than what you thought it was when you came into the field. And the Healthy Healer is really built for those people who are either just coming into the field and want to prevent this notion of burnout, or who are far into the field and realize that they're no longer resonating with the job that they presently have. These people, you who are listening here, who really are looking for what is it like to be a healthy healer, are at the point of the show is to be compelled by the guests and the conversation, such that you can realize that you too can fall back onto the track of being compelling and being inspired by the job that you're doing right now. You went into this work actually hoping to be a certain kind of player, a certain kind of healer. And likely by now, your job has shifted drastically. So you're no longer perhaps playing the same game you once played. The idea with the healthy healer is realizing that in order to heal someone, you need to create an honest to goodness human connection. And the only way you can connect with someone really honest to goodness, is by being aligned with your true self. If you're not aligned with your true self, you can't really connect. Who's connecting with that other person is someone who isn't you. The idea is to be resonating harmonically with yourself so that you can be the healer that you were born to be, so that you can be the healer that you aspired to be, that you can be the healer that you were educated to be. Today, we have a guest that's really taking us into a new level of what that means to be a healer. Who she's become over time is someone who has built on her past a level of passion, a level of concern, a level of commitment in an area that maybe she didn't even know that she was going to be involved in not so many years ago. I'd like to introduce to you Dr. Sadaf Lodhi. Am I saying it Lodhi? Is that right?
Lodi.
Yeah, Dr. Sadaf Lodhi today. Thank you so much for being with us. It's a deep pleasure. Thank you for being on The Healthy Healer. Welcome.
Thank you so much. I really appreciate your time and everything you're doing for your listeners. And it really is an honor for me to be on your podcast.
Thank you so much. It's really great to have you. In my podcast history, one of the things that I find is as a host that can be really helpful for the listeners and really helpful for both me and you is a difficult question that only has 9 letters in the entire question. It's probably the shortest question of all time. And it's one of these questions that, when answered, really, really opens up the gates and the doors for those who are listening to get a better handle on what are we up to. So that question, if you don't mind, I'd like to pose to you right now. That question is the 9 letter magical question of who are you? So who are you, Dr. Sadaf? Who is it that we're having a conversation with this morning?
Yeah, so thank you. My name is Sadaf Lodhi, and I am a board certified OBGYN. I'm currently practicing in New York. I am the product of immigrant parents that came over from Pakistan back in 1974. And so I was actually raised in Michigan and then grew up there, went to medical school there, and then now I'm practicing in New York. I have been practicing OBGYN and still currently do. It's been outside of residency about 19 years now. And but most recently, I started to focus on sexual health and wellness and menopausal health. And the reason why I did that is because I found that there was just a paucity in people actually practicing and dealing with sexual health. As you know, being a medical provider, that in medical school, we don't really get much education regarding sexual health. And what little education we do get is surrounded and based on research that was conducted in the 1960s, and really has changed much since then. And now the literature and the research focuses a little bit more on women. Before it didn't. Before, it was in 1966, what the model that we had was Masters and Johnson, and that was research that was based on white individuals, white men. And now, so there's more research on women. And in 2001, there was somebody by the name of Rosemary Basson that came up with the female sexual response cycle. So, um, in the real reason why I do it, why I do what I do, focusing on sexual health and menopausal health, is to empower women and to educate them about their bodies and their health.
Good. Okay. So thank you very much. That really gives us an idea of who you are. Now I have another question, which is, as you were growing up, did you know that you were headed in this direction, or when did it become clear that, focusing on women specifically, and then women's health, and then women, educating women about their body, their functioning body as menopause and sexual health are both, in some ways so uniquely well, let's put it this way: they're different from women than what they are for any kind of version that might exist for men. So there's a uniqueness in helping women get in touch with their own unique woman or feminine self. When did you know that you were headed in that direction, or that you had a superb skill to provide those kinds of services?
Yeah. So definitely when I was growing up, I never really saw a role model that I could see myself in. I didn't know very many gynecologists. I knew of one. And when I had mentioned to her after I had gotten into medical school, after I had mentioned to her that I wanted to do OBGYN, she actually told me not to.
Right.
She said it was, it's very intense, and
It is.
that you were never, that you're never really home with your family. And she actually told me to do anything but that. But, as you know, when you find a specialty that you really like, and that you really see yourself doing, you just kind of go after it. And I was pretty driven, and I really enjoyed surgery and medicine, and OB combines too. And plus, I really enjoyed the just the rush that you got when you delivered a baby. And so that was why I went into female medicine. And also because I really felt that in the way that where I grew up and things like that, I felt like women, um, there wasn't that much attention put on women and or women's health, and especially not being able to find any role models that I could see myself in, or even in their place. I just felt like that was something that I wanted to highlight. I wanted to be the role model that I never had, and that's really
Interesting.
why I went into it. Yeah.
You wanted to be the role model that you never had. That's really great. Yeah,
Yeah.
and by the way, my first rotation in my third year was OB-GYN, and it was extremely difficult. It was 1986, and the trying nature of simply the medical school rotation itself was extraordinary. I remember it was something that about 1986, because um, I was in Chicago at the time as a medical student, and the women that I was taking care of, there was a really significant World Series going on. The baseball World Series was going on about that time during my rotation, and people were naming their babies after some of the players.
Oh yeah.
So that was like there was like a little epidemic of each baby getting a player's name,
Oh, that's
and
funny.
it was kind of interesting. And the difference between there's a big difference between OB and gynecology. And tell us a little bit about what you've noticed there, and where any of your passions might lie differently in OB than in the gynecological field.
Yeah, absolutely. So, as you know, and I'm sure most of your listeners know, obstetric OB stands for obstetrics, and obstetrics is mainly taking care of women in their pregnancy, right? So it's really during those fertility years, and managing their whole pregnancy throughout all the different trimesters. Of course, the one trimester that we never focus on, which is the fourth trimester, which is when women deliver and postpartum, and that's also an area that really needs more research and more support. And that's, when women deliver, a lot of them will suffer postpartum blues, and some may even have postpartum depression and postpartum psychosis. And we know that one of the biggest risk factors to having a baby or a pregnancy is actually maternal suicide. So that is one of the main causes of maternal mortality, is maternal suicide.
Hmm.
And after that comes maternal hemorrhage. So it's really important that we discuss mental health, when women are pregnant and once they deliver. So obstetrics is great, and it's great for, delivering and taking care of women during that time. But, gynecology for me was more, even in residency, right? So we didn't really learn anything about sexual health in residency. We didn't learn anything about menopause. We didn't learn anything about postpartum depression. We just don't learn about these topics, even in a residency. And most recently, I was working at an academic institution, and even in that place, the residents didn't learn anything about sexual health. So it's really important that we are teaching our future doctors, but just it seems like nobody really is. Um, when it comes to gynecology, we talk mostly about like preventing disease and sexually transmitted infections, and about the different cancers and things like that. But again, we just don't discuss sexual health. We don't talk about it. There was most recently there was an article in the New York Times, I think it was back in November, that mentioned about the clitoris and how half the world has it, but nobody knows about it. Nobody talks about it, and just the whole function of it and the functionality and the purpose behind it. And then, of course, there was another article most recently, I think about 2 weeks ago, in the New York Times, talking about menopause. And now Oprah is talking about menopause, and everybody's starting to talk about it. Michelle Obama was talking about menopause. So, these are topics that we don't encounter very often. I don't know if it's just that there's a lot of taboo. I think our media and everybody's really focused on the youth and young people, and I think that's really important. But I think that there's an area where we could definitely devote more attention to and more research to, and that is, as women age, what are the things that they need, and how can we help them? How can we better serve them?
Yeah, beautiful. So I hear what you're saying. I have a question for you. Part of the theme of the healthy healer is this idea that communication, conversation, creativity, and specifically human connection are at the heart of all healing. Are you finding that as a woman yourself and someone who's maybe more aware, probably, clearly more aware of some of the intricacies of sexual health or intricacies of the effects, one way or another, of menopause or of regular hormonal changes of a woman, that in your connection with your patients or your clients, that there is a surge of healing that takes place inside of that connection, even more so than the information that you provide for these people?
100%, absolutely. So, I think that first and foremost, because I'm able to relate to the experiences that a woman has during this time, I think that they feel more comfortable talking about those changes. As you probably remember from med school, women go through hot flashes, night sweats, mood swings. They can have palpitations, they can have brain fog, all of those things, right? And so there's so much to it, and we just never talk about it. So definitely, women feel more comfortable talking to other women that may be experiencing the same things. And also, when it comes to sexual health, specifically during menopause, you have, and perimenopause, you can have vaginal dryness, you can have pain with intercourse, you have decreased libido, you decrease arousal, all of those things. And so, when you actually find a provider that feels comfortable talking to you and conversing, then it's almost like they're in your head, right? Like they know what you're going through, and they can talk about it and then articulate ways for you to move forward and move, perhaps get the help that you need or the medications that you need. Or maybe it's mindset, right? Maybe you need to talk about, the negative beliefs that perhaps you were raised with and how you move past that. Or maybe there's some body image issues, maybe there's sexual trauma, all of those things. So, yeah, I think that women tend to feel comfortable with me specifically just because I'm able to relate to them and to open up that communication that often, when they ask their providers, even their providers don't feel comfortable talking about, because we just don't learn about it.
Right, exactly. So I guess one question that comes up is it even possible to be an attuned male OB-GYN provider?
That's a great question. And, I don't want to answer for all the other 50%. I think that you can be. I think that there's a lot of men that perhaps can empathize with what a woman goes through, but I don't think you truly know, right? And I know that I've spoken to women in the past that feel that their providers have been very dismissive about their symptoms, and specifically during menopause, right? They'll say to them, "Oh, it's all in your head." In fact, there was a recent article, I don't know if it was in the New York Times or the Atlantic, but I know the author, and she posted on on her Instagram saying how she was dismissed by her gynecologist who told her that it was all in her head and that, her decreased libido, she needed to just go and find another partner and that, there was nothing wrong with her. I think that when we as providers become like that to our patients, then it really puts the medical profession under, I don't know. I mean, I just want to say that people just don't like going to physicians then, right? They don't appreciate their physicians being very dismissive of their symptoms, and they want to go to somebody that can empathize and relate and talk to them about their symptoms and then give them solutions. Nobody wants to hear that whatever symptoms they're experiencing is all in their head and it'll be fine if they just get a new partner, right? That's not what you want to hear. When you go to a doctor, you're hoping to find some solutions. You're trying to figure out what's going on with your body and what's happening, and that you want to know that you're not broken. There's not something wrong with you.
Absolutely, yes. And so you're speaking a little bit to this notion of the interface between mental health and OB/GYN. And it was frequent enough in a few of the hospitals that I worked in. I worked in several hospitals when I finally did get released as a resident, and then began to be an attending in Cincinnati. Um, that the consult conduit between OB/GYN and psychiatry was pretty strong for some doctors. There were some obstetricians and gynecologists who really felt that they could receive help, appropriate help from mental health providers, and I would be frequently in the consult liaison rotation that I was in at these hospitals. I could be frequently consulted by that particular subspecialty. Um, you had mentioned earlier that, this in the fourth trimester, there's sometimes things that can happen in the postpartum blues or the postpartum psychosis. What is it that you find you can do to really, this is kind of a loaded question because I'm no longer the same doctor I was back then, by the way. But what is it that you can find that either psychiatry can do or mental health can do, or you can do to help your clients in that fourth trimester when they're going through those psychological discomforts or psychological pains or traumas or miseries, or yeah, that might go along with being in the fourth trimester of a delivery.
I think you mentioned it before, and I think one of the most important things we can do is communicate, right? Communicate with our patients more than just at the 6 week visit. I think now what I've noticed is that there is a trend to see patients a little bit more frequently, even postpartum. I know that one of the clinics that I work at, they see patients, 1 week after, and then 2 weeks after, and then 6 weeks after. But I think that having that constant communication with the patient is really, really important because so many women suffer through anxiety and depression and blues after they give birth. And a lot of times they don't have that family support to help them navigate those emotions and those feelings. And so then, it behooves the provider to follow up on that patient. The problem that we have with our system is that, we are asked to see patients every 15 minutes. So it's hard to spend that time with that patient that may be suffering from a little bit of anxiety or depression or adjustment disorder after they have the baby, and to really figure out what's going on with them and how they're feeling. One thing that does help us as OBGYNs is the Edinburgh depression scale that we do postpartum, and also the PHQ-9, both of which help to figure out whether or not a patient is experiencing depression. Something that ACOG has recently, and I think it's been a few years now, but they've advocated for OBGYNs actually doing that depression scale in every trimester and definitely postpartum to help figure out whether or not a patient is experiencing anxiety or depression and whether or not they need additional support and help via a psychologist or a psychiatrist or somebody, or even meds during the pregnancy. And so I think that is really, really important to help patients navigate their feelings and their emotions during the pregnancy and even postpartum.
Excuse me. Um, so when someone is a gynecologist or when someone's in your field, if it does come to fruition that that doing the work is a little bit too arduous, is a little bit too demanding, and in fact, there are certain situations, of course, where your field is so demanding that it does stretch the actual clinician to find their own sense of mental health disturbance, their own sense of mental health imbalance or mental health discomfort. What do you say to other, maybe younger or even older people in your field, either as the doctor or the nurses or even midwives or anyone else who's actually managing inside of um, the female sexual health, or in fact even the menopausal health, who are running into the situation where they're no longer passionate with the job that they're doing. They're finding themselves out of line or out of tune with what they thought they were getting into. Do you know people like that? Number one, is that a possibility? Does that sometimes occur? And number two, what would you say to those people at this time in order that they can refine their own inspiration to continue doing what they came here to do as a healer?
Absolutely. Yes. So, I've definitely experienced burnout myself. I think that OB is a very intense specialty. And, in the beginning, when you're doing it, it sounds all very exciting. And, oh, you're running to this, you're running to that, you're running to deliver, you're doing cases, you're doing surgeries, there's a stat C section, all that stuff, right? The adrenaline's going. But, after 20 years of that, you're pretty much done. So yes, you have to absolutely find something that you feel passionate about, that you feel that you can almost reinvent yourself, right? Whether it's in the confines of your specialty or outside of your specialty. I found that for me, something that I felt was not discussed very often in not only just society, but even in our obstetric circles was sexual health. And so that was something that I became very passionate about, and also menopausal health, right? These are definitely two areas of gynecology that we just don't focus and we don't learn much about. And so for me, it was finding something else that would ignite my passion and that I would really enjoy learning more about. And so for anyone suffering through burnout, I would say that, try to find something that you feel really passionate about and to know what your why is. My why is to empower and educate women about their own sexual health so that they can have agency over their reproduction and their reproductive um, life. And that's why I do what I do. So I think that finding your own why, realizing what it is that you feel passionate about, and then going for that, whether it requires additional training, additional education, but finding that passion that then can reignite your love for medicine is what's really important.
Yeah, finding that passion. So in some ways, it might really require an about face, or really stopping and relooking again at why did you go into the field in the first place, or what's really here for you now, what's missing out of your life that you're no longer able to bring your deepest core self into the workplace, right? Like what,
Absolutely.
like, and are you finding that there is any kind of trends either towards burnout or away from burnout in the recent years? And I guess I'm not speaking directly only to COVID, but in recent changes in the medical field and how the medical field is seen by the rest of the world. Yeah, I wonder if there's been any increase towards a sense of feeling misaligned, or no longer resonating with their, or no longer inspired with the job.
I think that is absolutely a trend. I'm in different Facebook groups, and there are so many physicians actually looking to get out of medicine. Right. And I think it has a lot to do with the fact that, private practices are being bought out by large corporations. People feel like they're just a cog in this wheel and they're just spinning, and that they really are not getting paid what they're worth. I know that some healthcare providers get paid more because the need is more in a certain area and things like that, and others are not getting paid very much. And I think that when you work in a specialty such as OB, and the amount of malpractice that's charged, and the amount of risk that you take as a provider, and then to not get compensated what you feel is your worth, really adds to that burnout. And definitely, it is an increasing trend. So many OBGYNs are trying to get out of just delivering obstetrics because it's to them, it's just not worth it. The risk is not worth how much they get paid. And I think that, lots of physicians are trying to reinvent who they are, and also trying to come up with different streams of income such that, if they are experiencing burnout, or if they get fired, or, something happens, they experience a disability that they're not able to practice medicine the way that they want to, that they're not going to be left high and dry, that they can provide
Mhm.
for themselves and their family.
Right. So there's a real that's part of what my passion is, and part of the point of this particular podcast, as well as the course that I developed called Healing the Healer, which is really taking a look at our fellow brethren and sisters as well, who have come into the field on a particular passion. Pretty sure that they were blessed with a gift. Pretty sure that they had something that they could provide for the rest of the world, and then the job comes in the job description, as well as the actual boots on the ground of what it means to come to work every single day. And it kind of takes away and it maybe sucks some of the energy out of that slowly but surely, or sometimes abruptly, and leaves people feeling um, incongruent to who they are or who they wish they were. And I'm looking really to help those people. What would you say to some people in OB/GYN who are starting to feel that?
I would tell them that there is hope, right? A lot of times people feel hopeless. They feel that even though they don't want to keep doing what they're doing, they have no other choice. This is the only way they can make money. And I would really ask them to be curious. I would ask them to look at things that really excite them, that, reignite the passion that they once had for medicine. But it doesn't have to be medicine. It could be coaching, it could be something else, right? And then you can use your skills. And that definitely physicians are very intelligent. And, it can be other providers as well, but I'm just referring to OBGYNs. So, it's important for us to realize our worth, know that we are very intelligent people that are driven and that we're able to accomplish goals that we set for ourselves, right? We went through med school, that wasn't easy. We were able to go through residency, that wasn't easy. And then we were able to practice if we decided to practice, and to just know that we are capable of so much, and that what we do doesn't define us, and we get to decide how we want to define ourselves.
That's beautiful. So there's like an expansion of our resourcefulness, the idea that we are resourceful, of course, as shown by our recent history and who we were. In order to get to where we wanted to get to, we had to show a whole lot of resources. And then to get through all the hurdles that it became that were there for us in order to get to where we are now, it took a fair amount of resourcefulness. And we tend to forget that. We as physicians tend to forget that we have all sorts of room to do things that we're more passionate about than what we're doing right now, or
Ab-
to do what we're doing right now with a greater sense of passion.
Absolutely,
Yeah.
100%. Yes.
Yeah. Beautiful. Okay. And so when we start looking at the interface between like the women who are OB/GYNs, or women who are obstetrician and gynecologist, I just say, and then women who are in other fields as well. So we're looking more maybe like to family practice, or we look to the broader picture of general practitioners, et cetera. What is the difference, do you think, between the pressures of a obstetrician gynecologist and the pressures of being a woman in medicine in general?
Yeah, I think that, women in general, I know there's been several studies that have come out and that have noted that there is definitely a gap in pay, right? That men tend to be paid, even in specialties where now before, there used to be more men in OBGYN. Definitely when I was a resident, there were more men in obstetrics and gynecology. And then as I went through residency, and now I would say the trend is more that there are more women in OBGYN. And there's been definite research that has shown that whatever specialty women tend to dominate, that specialty ends up making less. So we make less money, even though we're doing the same amount of work, right? And we are still taking on the same amount of risk, the same amount of stress, all of that. And I think, especially for women, women tend to have an uneven distribution of chores, even when it comes to home. Women can come home and they, are, even if they're working outside of the house, they come home and they're, in charge of taking care of the kids. And then they're the laundry, the food, the meal prep, all that stuff, right? And when we talk about the uneven distribution of chores, that also plays into effect of how we feel about sexuality. When we are always focused on other things, then relationships, intimacy, that just becomes another chore. And so then women don't want it. And especially if they are not getting anything in return, right? If there's nothing in it for them, if they don't experience pleasure in their relationships, they're not going to want it. So I think that definitely stress starts to impact every aspect of our lives. And when you are in a very demanding career, such as obstetrics and gynecology, it starts to spill over into other aspects of our life, right? We're not able to, our sleep patterns are all disrupted. Our circadian rhythm is off. Our cortisol is on hyperdrive. We have adrenal fatigue. We, are not able to function properly. And they say that people that are sleep deprived, it's as if they are drunk, right? When they're driving, it's as if they're drunk. So all those things play into effect. And I think that that really messes with our mental health. And so I think it's very important for women specifically, and women that are in very driven, high pressure careers, to take a look at their lives and see if they're really happy with what they're doing. And if they're not, then to find ways to bring that happiness back. I think that there's definitely other specialties in medicine that are perhaps a little bit more conducive to, say, like a family life, to being able to spend more time with their family, with their spouse, with their partner, even just to have more time alone and away from medicine, right? That gives them that space. But when you're in a very driven and high pressure field, you don't always have that luxury. So I think that it's just important to figure out, why you're doing what you're doing, and if you're really happy doing it, and if it brings you joy.
That's right. It makes a lot of sense. Thank you. So, um, for other women who are like noticing that they're feeling burnt out in their field, if like, this idea you had mentioned that it kind of leaks into the sexual health, that they are burnt out with their everyday chores, with everything they have to do at home and everything they have to do in their occupation, or everything that they're doing, to get the kids from here to there, or to take care of food, take care of laundry, take care of chores, take care of their husband, take care of everything. And then there's not a whole lot in it for them. What are some simple practices that you can offer to these women so that they can find satisfaction in their day-to-day life immediately?
Yeah, absolutely. So, some of the things that I say is to find ways to create intimacy in your relationship that doesn't require really anything, right? Except for just being present. So, one of the ways that, and multiple research has shown this, that just being mindful in your day to day life. And I know that's a real buzzword, and I know it's like a hashtag and all this stuff, but really, it's truly been shown in research that if we are mindful in our relationships, if and as you're a psychiatrist, and I'm sure most of your listeners know that being mindful is just being present in whatever situation you're in, without judgment and with compassion. And so if we are able to be mindful in our relationships, then that actually increases arousal and desire in our relationship. Also, ways to increase intimacy in a relationship: you can have intellectual intimacy, where it's, you're communicating your likes, your wants, your desires, you're connecting through exchange of ideas or discussion. You can also have physical intimacy, right? Which we know it can just be even holding hands, it can be cuddling, it can be eye contact, it can be touch. It doesn't always have to be like a sensual type of touch, it can just be a hug, right? And that can create that intimacy in a relationship. It can be an emotional relationship where we're able to trust the other individual through honesty and share our innermost thoughts and feelings. Um, some ways that women can increase that intimacy, like I said, was, practicing mindfulness. They can also start by accepting and loving themselves as they are now, right? Just not waiting for that perfect body or for that perfect job or for that perfect time, but just loving yourself now, I think, is really important. Because when we're able to love ourselves, then we are then able to share that love with others. And I think that's really important. Also, realizing that love and intimacy is going to look different as we go through different ages in our life, right? That we may think that, perhaps in our 20s, our love was more spontaneous, intimacy was more spontaneous. But if we really think about it, we actually planned those events, right? So when we went on a date with somebody, we planned out what we were going to wear, where we were going to go, what time, we were going to be there, what it was going to look like, and how that night was going to end, right? So we actually planned those things. And so I would ask this person to also go ahead and plan date nights with your spouse or with your partner or whoever, and so that you have something to look forward to, right? So a lot of times intimacy gets placed on the wayside and we just don't make time for it because of all of the other competing things in our brain and in our life. But if we set aside time, then we will make time for that. And then that will only build our relationship and build that intimacy with our partner and our loved one. And I would also ask that, you continue to write down what you want and communicate what you want, because we know that in several studies, it's shown that the biggest factor in female satisfaction, sexual satisfaction specifically, is that there was communication in that relationship, right? Just the ability to be able to have that conversation. And if you find that that conversation is difficult to have with your partner, then maybe again, write it down in your phone, right? And so that you get notified that, at 9 o'clock, when we're both done with whatever it is that we needed to get done, we have that half hour or even 15 minutes, right? Even if it starts with like 10, 15 minutes to sit down and just be present with that other person and to talk to them and ask them, how their day was and what they like, what they want, what they desire, and make it fun and make it playful, but also keeping that communication open so that you can understand what your wants are and what your partner's wants are.
That's really great. It points a lot to what we're talking about, this idea of communication being at the heart of all healing. I think what you're really saying, and maybe I can, extrapolate this,
Yeah.
is that communication is at the heart of all intimacy, and intimacy at some level is at the heart of all healing in relationships. So maybe that's what we're
Mhm.
saying. Yeah.
Absolutely.
And
Beautifully
that's what
put.
we're really after put. That's what we're really after as humans, actually, is that level of intimacy being at the heart of our own healing.
Absolutely. I love it. Yep.
Yeah.
That's
Thank
exactly
you.
it. Yeah.
Yeah, so that's great. So, where can people find you if they're interested in continuing working with you, or they want to learn more from you, or they want to learn more about you, or maybe they want to become a colleague or a patient or a client, or they have a question for you? Where would people find you on the
Sure.
internet?
Yes, absolutely. So I am all over social media. I am on Instagram and TikTok at Dr. Sadaf. That's DRSADAF OBGYN. And that's on Instagram and TikTok. On YouTube, I am at Dr. Sadaf Intimacy Coach. And I have a website called drsadaf.com. And I have gosh, I feel like I'm all over the place. I have a podcast as well called the Muslim Sex Podcast. And you can definitely email me at drsadaf@drsadaf.com. So
There you
lots of
go.
ways to get in touch with me. You can definitely DM me on Instagram and I'll be sure to respond. So
That's super
yeah,
great. Yeah,
I'd love to
I'm
work with
sure
you.
that you're very reliable about your response. It's important to you to stay connected to the people in your world, and I truly appreciate that. I
Absolutely.
also appreciate the conversation that we've had today. Is there any kind of questions you would like to either ask me or any sort of closing thoughts that you'd like to bring into this conversation before we actually do taper this down?
Thanks. I think that, what I would say, and I think that actually you put it beautifully, is just that, communication is probably the most important thing in any relationship, regardless of what type of relationship it is. And that it's so important to be able to have open and honest discussions with your partner to create that emotional intimacy, which then eventually leads to physical intimacy. But it's really that communication which is the basis for everything. So I think that that's
Beautiful.
what I'd like to leave with. Yeah.
I love that. That's great. And we're in full agreement there, and I totally appreciate it. Dr. Sadaf, it's been a deep pleasure having you as a guest on the Healthy Healer. I look forward to playing around and working around with you and maybe even sharing some clients or some ideas in future consultations. I also look forward to future conversations in the podcasting universe and to following you and seeing what you're up to as you take on the cutting edge of what it means to be a communicating obstetrician and gynecologist. Thank you so much for being you.
Thank you. And thank you so much for your time. And thank you for the opportunity to be here with your guests. Thank you so much.
Welcome. Thank you again. And this is Dr. Fred signing off. Welcome to another episode of the Healthy Healer, and we will catch you on the flip side. Dr. Sadaf is here today, and we really have had a masterful conversation. I hope you enjoyed it. Bye for now.